Good morning, everyone. Good morning. Good morning. Really excited to be here today. My name is Erica Priscilla Sandoval. I'm the executive director of Siembra Today, a nonprofit that was recently started. We are a new nonprofit of incredible BIPOC women leaders in social work and beyond. And we're here to support our communities with mental health and wellness, but we want to make sure it's equitable for all. So without further ado, I wanted to say thank you to the Hispanic Federation and Uplift Grant for supporting this initiative and all the incredible social workers that are coming in today to learn how to better support the kids and families of immigrant families that are coming into New York. Today, I want to share a little bit about Siembra Today. We are going to have incredible programs sponsored by Hispanic Federation and Uplift New York. And I would love for you to please do us one favor and follow us on Instagram so you can stay informed about all the free programs and make sure that you join and connect in community and also learn and support your own wellness journey. In addition, it started with the books, Latinx and Social Work, which are a collective of incredible narratives by Latinx social workers of the diaspora coming together to share their own personal stories about their lives, about their trajectory in social work, about leading, about their struggles. And their brave voices has brought them into spaces where we haven't been before. So we are now an international brand that is known across the country. We have our books in English and in Spanish, and our third book is coming out on December 5th, and it is a mentorship edition. So please stay tuned for all these amazing news and all these events for all of you to join. I also want to give a huge shout out to our first incredible trainer and educator, Liz Espinoza. I want to share a little bit about Liz. So Liz is a seasoned professional in the field of mental health care with over 17 years of dedicated service in upstate New York. She holds a master's degree in social work from the State University of New York at Albany. With a profound commitment to her craft, Liz has cultivated extensive knowledge and skill in severe mental illness, crisis intervention, strength-based trauma-informed care, cognitive behavioral therapy, dual diagnosis, and mindfulness techniques. Her diverse experience spans across various demographics, including children, adults, LGBTQ+, immigrants, forensic cases, individuals experiencing first episode psychosis, and juvenile justice involved youth, among others. Throughout her career, Liz has navigated multiple care settings, including inpatient facilities, outpatient clinics, schools, higher education institutions, and community health initiatives. As an educator, she has taught primarily at the graduate level at an esteemed institution such as Simmons University, Smith College, SUNY Albany, and the College of St. Rose. She has taught courses on a range of topics: clinical skills, severe mental illness, group therapy, family therapy, forensic social work, psychopathology, community social work, and social work policy. She has such an incredible bio. We're going to continue to share her bio on the chat. And without further ado, I'd love to welcome Liz Espinoza. And thank you for doing this training today, Liz. Thank you.
Thank you, Erica. Thank you, everybody. Welcome. So I am going to share my PowerPoint and we can start from there. Again, my name is Liz Espinoza, pronouns she, her, and ella. Let me go here. I hope everyone can see that. And let me just go to the... So hopefully everyone's in the right place. This is what we'll be talking about today. Can everyone see that? Let me just move this here. We're going to do some intros, look at some objectives, and go from there. Thank you, Erika, for sharing a little bit about my bio. Here's a little bit more there. You can read on your own at your leisure. Um, well, this is the official, right, bio. I always like to share this one, and it's one that I've been including more and more often. Um, that really resonates as to why I do what I do and why we're even here, right? That little blurry picture with super pixelated, that's me and my mother in the rural highlands in northern Peru. And I often say, and I'll just read this, I find strength and inspiration honoring my ancestral teachings, the roots of, my upbringing. And it's grounded in a faith where um, myself, my family has confronted different challenges, and we've been able to move forward, with the gift of community and family um, as the foundation, right? So when I do this work, as much as I have all these credentials, the true credential for me is that I honor the teachings of my mother, my grandmother, and my ancestors, because that's what I feel and I believe and I think I carry with every piece of work that I do, every human being that I encounter. Um, so um, just want to honor that. And in a way that is not pathologizing, but humanizing our our experience here in this world. Um, so quick intros. I really want us to think about when we think of culturally responsive work in schools as social workers, what does this actually mean? How do we operationalize this, right? And I like to start with this idea of what's the story behind our name? You know, um, what is your full name? What is the significance of it? Why were you given the name or names you were given? Um, are the names meant to honor someone in your family? Is it a combination of names? Is it a mixture of an indigenous name? What have you? And is it personal? Is it familial? Is it cultural? You know, things like this. So I want to just see if folks are open and willing to share anything like that. I'm going to look at the chat, see if folks can share. Um, in the chat, if you're willing to do so, that would be great. Just going to look to see. Yay, I'm seeing some folks writing in. I'm just going to shout you out if that's okay. Um, Tanya, I want to say, or Tanya. I'm sorry if I'm mispronouncing. You can correct me. Your mom chose it. Great. Tony, you were named after your aunt and your grandfather. I love it with the I. Thank you. Other folks? Denise, your father chose it. Oh, I'm rapid fire. Denise, your father chose it. It was an old friend of his. Beautiful. Regine chose it too. Her best friend's name. Amazing. Um, Gaishano was named after your dad, whose name is Guy. Oh, it's funny how you grow into loving, honoring your name, right? Yeah. Thank you for sharing that. There's a whole bunch more. I encourage folks to look. Farah, Arabic name that means happiness. Oh, I didn't know that. That's beautiful. Ada. Oh, so many. Middle name is also your mom's name. Mikiel, an African tribe. And I'm sorry if I mispronounce. When I mispronounce, I tend to try to pronounce things as if they were in Spanish. Um, named after a singer, second name Rosario, because it was on a horoscope. That's beautiful. Oh, I know I'm going to be missing some. Named after Tania La Guerrillera, who fought alongside Che. Oh, I love it. Wonderful. Oh, I'm so grateful that folks are sharing, um, Amrita, nectar and immortality in Indian mythology. Oh, beautiful. And the person who gave it to you, your maternal uncle. Thank you for sharing that. Michelle. Oh, just so beautiful. I want to read them all, but I don't think I'll have time. But please, look and just even, we're just meeting, right? But talk about cultural, humility, talk about being comfortable and being willing to be vulnerable. I've done this presentation several times in person as well as via Zoom. And depending on the comfort with being vulnerable about, you know, who you are and how you show up in spaces, I've been in presentations where folks have not shared at all, even anything about their names, right? Because it is a vulnerable making, right? So I'm honored that you're allowing us as a group to know a little bit about you. Even our name can be very tender, right? I sometimes say it makes you feel a little tenderoni. Depending on the setting, you may not want to share those things. Um, I often share with folks both my names, my first and my middle name are flowers. Liz, Lis, La Flor de Lis, and Begonia, my middle name, right? But I often don't share these things in settings where maybe I might be misunderstood, right? So I just think it's a nice way to introduce what we're talking about. How do we honor, how do we respond culturally, depending on who shows up in front of us, the kiddos or the families or the teachers who are needing support to work with, our community. Let me go back to the PowerPoint. And so it's a little different. We may not be able to do this, in the little group discussions, but please, I encourage you to put in the chat. I think some folks started doing this already. What did it feel like to think about yourself in this way, to highlight, to share how your name is is a connection to X, Y, or Z culturally, familiarly, family wise? What thoughts and feelings came up? What concerns came up about even sharing? You know, what made you feel like you were more willing to share today in this setting, in this space amongst, this group? You know, what might make it less likely for you to share? Um, and what helped you feel open and willing to be vulnerable, right? So if folks could just put in the chat some of those, what came to your mind, where you're like, yeah, I'm excited. I want to share about my name. Or, ooh, I don't know. Will people understand? Or what was that for you? Right? Just this simple exercise. We're just meeting. We're going to be talking about how to support kids in schools. Why is this lady asking me about the significance or the history of my name? You know, if folks are able to put in the chat any thoughts or feelings that came up for you. Very personal. Yuresa shared. Thank you. Any other thoughts? Oh, thank you, Regine. So I want to highlight that. Someone shared, Regine shared, feeling more comfortable because I had shared something about myself. Thank you. Funny how those things work, right? Um, oh, yeah. Okay. Thank you for sharing that. Um, Tanya said she felt nervous at first, but then you felt safe sharing. Nice. Oh, right. We attach so much meaning, or is it going to be good enough, right? And where do those, thought patterns come from to judge or try to quantify, who we are? Um, okay. So Patricia maybe felt more comfortable because she knew someone here. Oh, oh, Patricia, sorry, no, I misunderstood. But great. Thank you. Okay. You can tell I'm a therapist, right? Um, let's see. So I like to start with that just to kind of, you know, make some rapport amongst us as a group. So what are we here to do? What are we here to talk about? what do we hope to get out of this, discussion, conversation? Um, the how do we address being culturally responsive in, in New York State and the education system that we work in, that we're a part of, where we're seeing, you know, kiddos that look like us, you know, and families that look like us, perhaps, come in and try to, engage in the education system, engage in the system as a whole here in this country, in this state. Um, why even bother talking about culturally responsive support as social workers? What does that mean? Is that just another fancy way of saying cultural competency or cultural humility? Um, who benefits from us engaging in culturally responsive ways in the work that we do with kids and families and schools? What are different strategies we can use to do this? What might it look like? Is it set in stone? You know, why should we engage in this? How does this benefit us as social workers, the work that we do? How is this going to help a kiddo get through their school day? And what are some tools that we can use? Where are some places we can find some of these tools? Things like this, right? And I'm going to use an example of Ossining, New York, which is located in Westchester, as a case example, to highlight this. And at any point, if folks have questions, need me to slow down or clarify something, please just put in the chat and I'll pause. I see something in the chat now. Thank you. Welcome, Julia. Okay. So, don't know if folks are familiar with the culturally responsive sustaining education framework that New York State Education Department implemented in 2018. Right, there's a lot of parallels between the framework and social work, um, what we follow and value in social work, the pillars, and things like this. So I really wanted to look at how this parallels what we do, um, as licensed professionals in New York State. Just a little bit of the background. Part of why this was implemented by New York State Education, was they're honoring and recognizing the systemic inequities, in how we approach education, for children, in a more inclusive way, trying to be more inclusive now versus, trying to fit everyone in, one mold. And the four pillars, which I think, we're going to look at one or two of these, are really important for us to keep in mind. The first pillar being welcoming and affirming environment, right? What does that mean when we're thinking of social work, when we're thinking of immigrant children and their families? You know, second pillar, high expectations and rigorous instruction. What is cultural responsiveness? How is that relevant to that? To kids being successful in school, right? How might an inclusive curriculum and inclusive assessment process be helpful in that? And then the last pillar, ongoing professional learning, right? This framework really tries to highlight and emphasize how differences, cultural differences, are and can be used as assets, and in supporting the education of children and incorporating the families into their children's education process and success. Right. To learn more, we're not going to go at length. There's like tons and tons of pages you can read about. But if you go to newyorkstateed.gov/CRS, you can read at length the framework and etc. Things to think about, right? How do we do that? How do we, you know, engage kiddos? How do we engage their culture, what they bring to the table, their strengths, what the families bring into supporting their adjustment, their engagement with education, with the education system, right? And why is that significant? What are the studies showing? Why is that so relevant? I just want to highlight from the one of the first pillars, how we play a role in one of these pillars. We play a role in all of them. Um, what does it mean to create a welcoming and affirming environment for these children? I've done some consultation work in Austin specifically, and some of the things I noticed off the bat when I first walk into the schools, elementary schools, middle schools, and high schools, what is their signage? How are folks greeted? Um, how is culture and language included? How is it supported and welcomed or not? Or is it indirectly being chastised or shamed or seen as a burden versus as something to work through, right? Um, is there signage in English and Spanish? Is there someone that is bilingual that can support translating or engaging with a family or child in a regular setting, in an emergency setting, what have you? Um, right? And so I want you to think about this. If you do work in schools, you know, what conveys a welcoming and affirming environment? Um, and what are things we can do to increase that or improve that? Something that as social workers, especially in schools, that we are um, often assigned to do, and also part of the work that we do, you know, at the core of social work is, doing, social histories. How do we learn about the kids? Do we just get the history from the teacher, from an observation in the classroom? How do we talk to the families who are super busy and they don't have time to come in? Maybe their phone's not working. Um, what is the living situation, right? I think of myself as an immigrant. When I was a kid, my living situation was very different than my peers in my classroom, right? Who lives at home? Does the kiddo live with their parents or extended family? How many siblings, etc. Who does the child spend time with? Um, things like that. So here are just some things to think about if you haven't already incorporated into your social histories, things to include that can help, you know, um, make sense of what's happening at home to help contribute to and foster a space to, you know, engage in education, or what might make it a little bit more challenging, right? I think of when I was a child, my kitchen table, was my desk, was my place to concentrate and do work, was also the party table. So what are those things that, you know, impact the child's life at home to, while they're learning to be a learner? Um, and questions you can ask. There's a link also for more extensive list of questions, things like that. But I know that has been helpful for folks. Um, and, you know, I'm assuming I'm talking to the choir here, but I'm sure folks have heard of the cultural iceberg, right? Um, Culture isn't just the things that, immediately come to mind, like maybe even a name or a language or food. Um, right? Those are the things that we see on the surface, perhaps art, dress, what have you, greetings, right? What That's just the tip of the iceberg, right? Tip of the cultural iceberg. What are other things that we don't know as easily when it comes to culture, and how do we keep those things in mind, right? I often talk about the example of eye contact, right? As with many immigrant children and families that I work with, and even myself when I first came to this country, eye contact um, was something that um, was seen and valued differently, is seen and valued differently, right? So, is there a cultural piece there? Talking to authorities, Is there a cultural piece to understand, to better understand? I see a question. Yes, Farah, to answer your question, the presentation should be is able to be shared, and if we can't do it now, we'll do it a little later. But thank you for asking. Thoughts, questions, reactions so far to what we're discussing? I wasn't going to play the video just for time's sakes. And again, this conversation might be new, might be redundant, or a little bit in the middle. But just what is the difference between cultural humility, cultural competence, and how does this factor into being culturally responsive, right? So the idea of being culturally humble, right? Doctors Tarvalone and Marie Garcia developed this concept, right? In the 90s, while working in California, and really keeping this in mind. And I think of cultural humility just, always being open and willing to learn, right? Um, and the three key concepts, components, being a lifelong learner and also being critically reflective of yourself and how you show up and how you see or perceive the world around you, or um, within the context of those that you work with. Um, Honoring, recognizing, and also challenging, the inequities, the power imbalances in relationships with the work that we do with the children and the families. I think of, conversations I've had with folks about engaging with calling children protective services, you know, um, with undocumented or mixed documentation families, right? Institutional accountability, you know, what is the organization that we work for? How do they show up in this conversation? You know, are they funding mandates, or are they paying lip service, or do they need to do a little bit more? Right? I see a couple of questions in the chat or statements. Okay. Thank you for these examples. Absolutely. Yes, it's not easy. And there's always something new that comes up, correct? Right. And how do we do this? How do we remain culturally humble versus thinking we can arrive at a certain place of cultural expertise, right? I think of myself even with this presentation. I am from Peru. I was born in Peru. I came to this country. There was part of my immigration story where I was undocumented, right? And I do this case example in Austin, and I look at the community that has come in from Ecuador, and you know, unconsciously, I was engaging some cultural lack of humility. Or I'm like, oh, there must be a lot of similarities because Ecuador and Peru, they're neighboring countries. But I had to remain open and willing as I was doing my research, as I was engaging in consultation work with um, this this school district and this community. There was things that were new that I didn't know about, and I had to be open and willing to learn and incorporate that in the work that I was doing. I don't know if I play this, if folks will be able to hear it, but let me just see. If not, we can skip it and you can look at it on your own. Let me see. Can folks tell me if you can hear the audio?
One word to describe cultural humility for me is love, actually. If I had to encapsulate cultural humility, or the whole concepts of cultural humility, um, it doesn't do it justice, but the word that I think of it is essence. Escuchar. You. Opening. Receive. Compassion. Love. The principles of cultural humility offer one more framework to contribute to what has got to be our ultimate goal. Yes, our ultimate goal is that there will be a sense of equity, a sense of equality, and a
a kind of and a kind of respect that we are driving forward. Cultural humility that is a multi-dimensional concept.
No audio. Oh, oh, it's back. Okay. Okay. Were folks able to hear it? Okay. Thank you, Bridget.
And certainly Melanie Tervalon and I conceptualized 3 dimensions. The first is lifelong learning and critical self-reflection. And in that critical self-reflection, it is the understanding of how each of us, every single one of us, is a complicated, multidimensional human being. Each of us comes with our own histories and stories, our heritage, our point of view. You're looking at me now. I am very fair skinned. When I was a little girl, my hair was blonde. My eyes are blue. People often tried to call me anything but African American. I have a history. My identity is rooted in that history. My parents gave me the knowledge of my own social identity, and my own experience in life has created that. I get to say who I am. The second tenet, after self-reflection and ongoing lifelong learning and development, is this notion that we must mitigate the power imbalances, to recognize and mitigate the power imbalances that are inherent often in our clinician patient or clinician client or service provider community dynamics. And then finally, the piece that I would offer that Jan and I feel people often either don't read or don't like, which is, and the institution has to model these principles as well.
I think that we can send this video to everyone because there was a.
African American nurse is caring for a middle-aged Latino woman several hours after the patient had undergone surgery. A Latino physician on a consult service.
Oh, okay. So I'm gathering some folks are having some audio difficulties. So I could always. Okay, some people can hear it, some people can't. Okay. 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 I can try to play a little bit more, but if there's still audio, I can just resume the presentation. So let me try. I think there's only like 2 more minutes left. Let me see.
Approached the bedside and, noting the moaning patient, commented to the nurse that the patient appeared to be in a great deal of post-operative pain. The nurse summarily dismissed his perception, informing him that she took a course in nursing school in cross-cultural medicine and knew that Hispanic patients overexpress the pain that they're feeling. The Latino physician had a difficult time influencing the perspective of this nurse, who focused on her self-proclaimed cultural expertise.
It was curious to this Latino physician who, first of all, was Latino, not like all, in his case, not like all Mexican Americans know everything there is to know about Mexican American patients. That wasn't it, but he might have been a resource for that African American nurse in that moment, that she didn't feel like she needed, again, because she had bought into this notion of competence, of cultural competence. The distinction between cultural humility and cultural competence was that we were in a process and a relationship that had many other layers to it, and that we were less comfortable with with even the term of competence in a way that I think people understand well, and that it implies, especially for people who are providers and are trained in academia, that you are then all knowing and all powerful. And we felt like that was not what was happening for us as we were learning from community and understanding in a very practical way how families were coming to the hospital and feeling as if they really were not being heard from their own heritage and history, and how that impacted what they came to the hospital with that we didn't know anything about, hadn't even a clue about. For us, this is part of the humility piece of it, getting to understand that I'm not trying to humiliate you, not trying to make you feel bad, trying to help us all understand that life is like this, and to, in a certain sense, be really happy about not knowing. In April of 1992, in the wake of the Los Angeles riots, following the initial not guilty verdict of the police officers accused of beating Mr. King, the Children's Hospital Oakland community was compelled to meet in a series of highly charged sessions to expose and critique our own patterns of institutional racism, injustice, and inequity. My name is Dr. Melanie Turbalon, and I am Director of Multicultural Affairs here at Children's Hospital Oakland.
I want to thank everybody for coming to what is a celebration for me of this year.
Jan and I had the good fortune, really, to be together in the same place when this work was evolving. Jan and I, while we're several years difference in age, are both African American women, and both raised by women who were teachers. And we come out of that, and fathers who were working men, who come out of that Southern tradition and who participated fully in the civil rights movement in the way that meant that they made sacrifices and their children made sacrifices, and they taught us about those sacrifices and raised us each in ways to understand that we were here to serve.
Okay. Oops.
One word to describe cultural humility for
Sure.
me.
Okay. Let me just see. There's things in the chat. Okay. Thank you. Sorry about that. I've never had audio issues with that before. So what does this look like? Cultural humility in the schools, right? I give an example here of, someone interning in elementary school, in a school district in rural, upstate New York, with where there's a large Puerto Rican community, and hearing, I'm sure folks that work in schools have heard this before, the families are not engaged, right? They're not sending in the forms that we send home. They're not coming in for parent-teacher conferences. They're not responding to the letter. Their child hasn't, gotten X, Y, and Z shots, what have you, right? And what was found out was that a big piece of this puzzle, nothing was being sent in Spanish home. No one in the school district, let alone in the schools, spoke Spanish, provided information in Spanish to the children, and primarily to the families, to the caretakers, and thus they weren't responding. When this need was noticed and an intervention was created and implemented, there was a huge difference, right? Conversations had to occur at the district level with principals. There had to be some buy-in. Interns were able to engage in translation work, get it approved, and, within a few months, forms were able to be translated formally into Spanish and sent home. Messages were created to be shared with families when they come in or when they call or when outreach is done, and networking with a local Latino organization also occurred to provide support for the families. Um, but something that initially was looked at as one thing, these families are not interested in their children's education, really was disproved by observing and looking at what is the need, what can, improve this. And it was something which for many folks that are bilingual seems like, oh, it's an easy fix, but you don't think about that if you're not thinking about language, if you're not being open and curious to the differences and what might be needed in a community. Right. Um, and this is a true story, and this happened, in within the last 15, 20 years, so um, and it's occurring now again with children and families that are, moving or being asked to move to rural areas in New York State specifically. I don't know if folks have examples of this, um, where you live or where you work. Um, and just looking at, what does it mean to be culturally responsive, culturally humble within the context of, our ethics as social workers, as licensed clinicians, as licensed social workers in the state of New York, right? This falls in line to everything that, we do and how we do it, right? Um, right? Incorporating in everything we do, being very self-aware, right? Noticing these things, and then incorporating it, advocating and addressing it to improve the quality of life, the services that we're providing. And in the context of children, increasing the chances of their success in school and incorporating them and their families, within the education system and process here, right? And providing folks what they need, not just what we always do, because that's always been done. So I don't know if folks keep handy a copy of, the social work, ethics material, things like this. But I always like to keep it in mind, especially when we're advocating for things, especially in the roles that we have and we're given, to support the success of children and their families in the schools. I have another example here. I don't know if folks recall, there was an influx of folks that came from the Burma area in the last 10, 15 years. There's a refugee center here in the capital region. And this is another great example where being culturally responsive was much more helpful in the moment, right? Staying curious about what someone may need, so folks should just take a minute and look at this. I'll try to read it slowly. During a fall day, a 7-year-old little girl was escorted to her first day of school, elementary school, and she was dropped off by a refugee case manager and was greeted by the resource officer, Mr. P, and shortly thereafter by some social workers at the school. There was a concern right away because the little girl kept running out of her classroom and was sobbing profusely and just grabbing onto her backpack so tightly. And the school was on a corner in a pretty busy intersection. And so there was concern because she kept trying to not only leave her classroom, run out of her classroom, was trying to run out of the school, was trying to climb out the window, right? Screaming at everyone that tried to come close to her. And mind you, she was 7, but because of malnourishment that she had experienced um, for years, um, she was even smaller than her, most of the kids in her classroom, let's say. And when I arrived at the school. I had connections with the refugee center. I was told, we need to locate them, there's safety concern, maybe, a parent needs to come in. But there were so many logistical issues, right? No one knew what language the little girl spoke. No one in the school spoke it, let alone in the district. And the only contact at the refugee center was not answering their phone. And this little girl was in the family resource center, grabbing onto her back for dear life, sobbing, that sobbing that like you're like hiccuping almost, right? And tears, boogies, and all these adults were surrounding her, right? And in an attempt to help, but as a 5'2" person, and as a, knowing what it's like to have height, um, proximity and height, reservation, so to speak. Um, I remember asking folks, can we just, disperse? Can someone try to find some food, some water? Can someone try to call another person at the refugee center? And can someone else, bring some paper and crayons? And the room dispersed. And slowly, we were able to do some things. But before I tell you the rest, I want you to think about, has something like this happened? What has been done? What would you have done in the situation? You know, um, to calm her, to support her, to address the need. And then a second question, pragmatically, systemically, what would need to be implemented to improve a situation like this? What would need to be implemented? What interventions, right? I don't know if folks have any thoughts or ideas. You could put it in the chat. What would you do in a situation like this? You know, there's a language barrier, there's an emotionally distressed little girl, there's an inability to reach someone that can communicate and or reach the parents. What are some things? I see some answers in the chat. Oh, okay. Any thoughts? Okay. Well, think about it. Think about what would you do if something similar has happened. Okay. I see Patricia said use visual aid, pictures of food, bathroom. I love it. Great. Candy wrote, I'd bring her to a calm space, use a computer to communicate. Oh, great idea. Ada wrote, I would come down to her level, sitting on a small chair, sitting on the floor, and use a soft voice to get her attention. Yes, yes, yes. I love it. Absolutely. All wonderful suggestions, ideas, interventions. Chelsea wrote, clearing the room to 1 to 2 people, having one person be point person for contact. Absolutely. Kneeling to her level, offering water, snacks, toys. Oh, it warms my heart to hear these answers. Yes. Snacks, coloring books, games. Absolutely. Absolutely. Thank you for that. Right. So, you know, questions, that hopefully were or are percolating in your head about this case. And you've answered some of them, right? So I always think of safety, basic needs, calm, right? And folks spoke to that. So, similar to what I started sharing and what some folks suggested in the chat, the room was cleared to have less people there. Basic needs were considered, right? Food and water. We're able to find alternative ways to reach the refugee center to be able to get family to come and pick her up. Right. And we did just that a couple of people suggested. I sat on the floor, crisscross applesauce, and I just started, my stick figure, sophisticated art skills. I just started drawing grass, a tree, a house, stick figure people. And and then I would draw and I just pushed the sheet a little further closer to the little girl who just grabbed onto her backpack and put her snacks in her backpack. But by this time, there was less people. Um, she seemed to be calming, as evidenced by there was less crying, there was more engagement, eye contact, proximity. She was willing to let me sit closer to her. And eventually she started drawing and she drew her family and she drew her family outside. This little girl had grown up in a refugee camp, and being in an enclosed setting had been overwhelming for her. Um, she finally was able to get to a place of calm where she actually did start drinking, some of the juice. And then we were able to find someone that eventually brought dad, and she was able to be picked up and she was taken home. Right. But some of the things that happened afterward, and addressing the system, right? With a between the school district, the police department, and social work interns, they were able to create like a ID clinic where at the refugee center, the police department came and took pictures of the kids and their addresses, all correct names, numbers, addresses, so that the kids, when they were being picked up, bussed in and out of the school, they would be sent to the correct homes. Because one of the things that had been happening, because there was such a huge language barrier, kids were being dropped off at wrong houses. Right. So some of the things that came out of this, when the school district was willing to be culturally responsive to address this need, um, it was very helpful. Right. Kids the kids going to the wrong houses stopped immediately after that, intervention. Right. Things like that. Um, check the emergency cards. Absolutely. Thank you. Yes. And so, we're talking about social work in schools. Like, why is this meaningful? How is this related to education? You know, um, why do we want to do this? How do we do this? What kind of questions? How do we incorporate the teachers, the administrators, custodians? Um, why is this impactful? Right? Um, because studies are showing, right? If we feel safe, we're going to engage better in the settings that we're in. Children are no exception, right? If there's a sense of psychological safety, our brain's going to be better able to learn or engage in what's present. If we're in survival, psychological survival, we're not, right? Um, and so just things to think about, ways that we can support children feeling and families feeling psychological safety in school settings. And it may not always be possible, right? That's also part of the reality sometimes of these dynamics. Um, but honoring, acknowledging, and addressing it and showing up for that, right? Thinking about mandated reporting and immigration status, you know, um, things like that. Do folks have examples, or does this make sense? Can you identify some of these things, um, in the settings where you work in? You know, um, I've had many conversations with clinicians as well as with, folks in the schools about mandated reporting when there's a family where there's a caregiver that has undocumented status. What does that mean? How do you address that? How do you bring it up? What is the mandated reporting concern? Um, things like that. How do you address it when there's an immigration status issue? Right. What are some things that the schools that you work in do? You know, um, how is this incorporated? What are you aware? How do you become aware of what are the impact, the social, political, economic impacts, realities of children, their families, and their countries of origin. How does that impact their day to day? You know, the election in Venezuela, I'm imagining that's impacting a lot of the Venezuelan diaspora, all over the world. How does that impact families and how kids show up? I mean, we're in summer, so maybe in summer camp, right? Things like this. And who do we talk to? Where do we learn this? You know? Switching gears now towards the case example that I have with Austin, New York. These are just some of the stats, more recent stats that I found. Obviously, it's not exhaustive, but there's a big immigrant population for this small area in Austin. The schools, there's some stats that I've seen at the district level where, kids are, huge, a group of the kids and families are not only immigrants, Spanish speaking, also recently arrived, right? So there's a lot of layers there to think about incorporating the work that we're doing, right? When we think of psychological safety, I like to use this example of a young man in high school, a few years back in Austin who this didn't occur while he was in school, but it was in the news, right? This high schooler was deported, even though he had status to be here legally um, for unknown, not completely unknown reasons, alleged reasons. He was deported. And this was all over the news in Austin. And there was even some protests but I shared this example from Austin not too long ago because, you know, that in and of itself, can we imagine what is that doing? What did that do to the community? The sense of safety, right? Psychological safety for kiddos and their families, the high schoolers, right? Even though this didn't happen in the high school, um, I I can't imagine it didn't impact, you know, the sense of safety kids had going to school or bringing things up or even engaging in school if there's a real or perceived fear or if they knew someone that experienced this, um, being deported, right? Um, part of this work, part of doing consultation work, I learned a little bit more about the specific Ecuadorian community in Austin. Where do they come from in Ecuador? And what I found, and it made sense because with some of the children, the families I work with, there was these nuances that were the things that were new to me, cultural wise, right? I was able to find information that um, there was many in this Ecuadorian diaspora that came from a rural southern part of Ecuador. Where within this population, there was a higher percentage of folks that had indigenous cultural components, cultural backgrounds, right? And a couple of other dynamics, right? So this made me think of, well, when I think of working with families here, I'm not just going to be thinking about even just culturally, Latino, Ecuadorian, and just Spanish, but I'm also thinking of subcultures, indigenous cultures, indigenous languages, right? Um, what else needs to be included? Does material for these families not just needs to be available not just in Spanish, but maybe even Quechua or other, languages that are present in the community, right? Didn't think about that until I started working with these families, with this community, and started researching, trying to be culturally curious, culturally humble as to how to best support, you know, these folks. Um, Things to think about when we're thinking about social work. We're asked to come into a classroom, kid, is falling asleep, the teacher's trying to get their attention, they're acting up, it's all of a sudden something's going on, right? Like, how are some of these things showing up and how might they present at different age groups, right? Um, I've worked with kids who have a fear of either themselves or a parent being deported. What does that do? It wreaks havoc on their central nervous system, right? They might have more anxiety than most kids, right? It might extend to, you know, school, at playstations in the classroom, things like that. Or there might be restrictions that are at odds with the development of kids at that age, right? I was undocumented as a child, and I remember I was not allowed to do any sleepovers. Even in high school, it was like pulling teeth, right? Because of this fear. What if someone gets in trouble and you get deported? What if something happens and mom or dad get deported, get arrested, what have you, right? And it's even as young as in elementary school, kids are showing up to school with this on their mind, this on their shoulders. Um, okay, Farah, thank you. You mentioned the acid-based questionnaire. Wonderful. Thank you. Thank you for sharing that. In middle school, how might this show up? Similar to what we just discussed, you know, um, resentment, abandonment, attachment challenges, right? I think of the families where children, out of survival necessity, parents, came to the US first and the kids stayed in the care of a grandparent or aunt or uncle for years in their, at the onset of their life, and then at 5, at 10, at 15 are brought to the States, right? And then there's like issues between parents and children, and it's impacting how they show up in school. You know, who is this person? I've never seen them, and now they're wanting to parent me. My grandmother's my parent. I want to go home. I miss my grandmother, right? We hear stories like this. Or kids trying to be very Americanized, and parents struggling with that. And how does that show up? How do we impact that? How do we broker conversations between parent and children? How do we broker how that might impact how kids show up in school, let alone, um, as learners, right? I know kids who sometimes show up at school tired, even at middle school, because overnight they're going with their parents to go work, right? And how do we know that? How do we talk to our teachers, our educators to keep that in mind? Is that a CPS call or not? Like, how do we talk to the parents about this, right? Um, you know, what does this look like, you know, within the demographics of high school? Things that we might hear, you know, um, if a kid comes to the realization that they may not be able to uh, go to higher education because of their status, right? What does that mean? What kind of thoughts and feelings come up? You know, talk about, fear of missing out or fitting in, you know, um, how do we support our children? If this is something that's going on, how would we support the families? How do we address this with the teachers who may not even be aware that this is a dynamic that their students are encountering? How do we bridge that? How do we inform? How do we support? Right. Um, so I'm just mindful of the time, and I wanted to make sure that we had time for questions and also um, for clarification. If folks have questions, thoughts, feedback, examples that you want to put in the chat, that would be really great to look at right now. Just seeing here. Um, any questions, um, any examples, any tools that you're using, any tools that you want to learn more about, you know, how do you support the teachers who are already overwhelmed as it is with everything, all the mandates that they have to follow? And then, you know, a kiddo shows up, you know, needing additional supports in these ways or others. Questions, thoughts, feedback. If you could put it in the chat, that would be wonderful.
I have a question.
Yes.
Great. I was trying to type in the chat, but I figured I'd just unmute myself. It's Erica, everyone. So that's the only reason I could unmute myself. Um, I really truly appreciated the fact that you mentioned, is it an ACS case? It is a CPS case. If they find out that kids are working with their parents in the evening, at night, and that is so important to me because oftentimes we jump into that report, that mandated reported role. And having that culturally humble lens of understanding holistically what's happening within the family system, because I was also that little girl. Not that I went to work with my parents in the middle of the night, but if I had to drive with my dad in a car because he was a messenger and my mom was going with him, I'd have to go with him, right? Because that's just what we did. My mom wouldn't leave me alone. If they're picking up bottles, because this is a lot of things that are happening within our community. They're collecting bottles and after evening hours, and they have a little neighborhood tour that they do. I know this because like I see so many families, we actually leave them out like nice and neatly for them just so it could be much easier. And they're doing this in the evenings, and they're walking together. So do we call it work? Do we how do we phrase it for teachers? How to for them to be more culturally like humble and understanding? Like how do we phrase it for them so we can minimize that potential risk of that report when it's not really a potential case?
Absolutely. Really great. Thank you so much for your question, you know, and your feedback. You know, I have a couple of cases that come to my mind actually. Um, I was called by a school district asking for some consultation support because a group of kids came in, elementary age kids, to the school district, and they were all claiming, this is the language that was shared with me, claiming that they were of cultural status. They were families that were from Venezuela. And then come to find out a month or two in, a couple of the kids started sharing they actually weren't really Venezuelan. One kid said that they were from Colombia, and a teacher's reaction in a rural area was like, you know, why, you know, these kids are lying, they're liars. And the administrator that called me, you know, wanted to understand why would this happen. And I had to share, right, the cultural context, the cultural relevance of why uh, a parent might choose to um, do that and tell a child to say one thing when it's not true, right, in the schools. And I had to share, you know, when you think of, you know, immigrants who arrive with undocumented status or a pending status, right, a fragile status where they could easily be deported or sent back to a dangerous situation, either politically, financially, socially, or all that, um, you know, our ethics might change when it comes to survival, right? And so to not see it as these children are liars, which was like what some teachers were starting to call these kids, and these families are liars, but to understand that contextually, they are in survival mode and they're doing the best they can and saying what they need to create a safe place, have their children in a safe place, which would include, you know, even saying that they're not from where they are to, you know, get a better chance of staying in the country, right? So reframing it as a sense of safety versus these children and families are bad, are pathological, are lying, etc., are crooked, you know, criminals, what have you, which was some of the lack of knowledge and then fear and frustration was creating these narratives that weren't actually based on understanding the whole context. And when I shared that with the administrator, it was very helpful. She was able to go back and speak to the teachers and say, you know, this is why this might be happening. And it shifted things. Kids were not treated as, um, these pariahs, which was starting to happen, right? Other conversations about calling protective services. I remember talking to a student, let's say we find out there's corporal punishment, but there's a parent, a caretaker that is undocumented and is the main or only breadwinner. What do we do? you know I often share how I've talked to families about why that can't happen, the ramifications in this country, how that could be very real, about how that could also impact the things that they fear, right? It may mean you still call. It may mean that you don't call and you have regular meetings with the family. I can't tell you what to do or not do. What I can say is having understanding of the context and incorporating that in the decisions that you take or that you advocate for a child and their family is very important, because it's not just cut and dry, right? Because it could have, a greater impact, right? What if a family is separated and it could have easily been solved by a conversation? This was okay in your country, it's not okay here. And the family learns it and just stops it. I hope that was helpful. And then having conversations, tons of conversations with the folks that are involved. When I worked in the school district, um, a lot of my downtime was developing rapport with teachers and administrators in hopes that, there was enough rapport that I was able to share some of these realities that they weren't aware of. So when these kiddos showed up, they would be able to see them as a whole, not just a behavior, not just a nuisance, right? Not just something that they fear or hear about on the news. Regine, great question. I think, unfortunately, I want to say every school district is different. I want to say all safety officers get all the training and support they need, but we know that reality, it's not, in the reality, that's not the case. Depending on school districts, how many people they have, the budget, training, they may not, or maybe very quick, or maybe, it's like, uh, a 1 hour video that they watch. It's not even something live, or it's a handout and a checkbox. Um, yeah, the uniforms can be definitely very intimidating for sure. How do you reconfigure during a home visit, right? Um, a joint home visit, things like this. So absolutely. If there's no other questions, I'm going to, I want to remind everyone, please, 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 if you're here and want to make sure you get some CEUs, please fill out the survey. If it's not in the chat, hopefully it'll be in the chat shortly, the link to the survey. Please, please, please do so. It's helpful. It's helpful for, to make sure that we have more events like this, where folks can also benefit from CEUs, things like this. No other last thoughts. Thank you so much. And I'm going to hand it over to Erica.
Liz, stay on. You're amazing. Stay on with me for a bit. Thank you so much, everyone, for attending today. Liz, you're so incredible, so compassionate, and just so informative. We really appreciate it. Do you have any last thoughts on how to better support in the question that I believe that Regina asked? She asked, do you know if the school safety officers receive culturally responsive training? They're usually the first people families are like in contact with as they walk through the school doors. And so, and has there been any conversations of how to better maybe incorporate these trainings, or maybe develop these trainings and then present them in schools? Have you been keen to understanding like some things that they're doing?
Absolutely. Yeah. So I have been part of doing professional development trainings in school districts on this specific topic. But again, it depends on the district and depends on the culture of the district. If folks are willing to engage in that, incorporate it, bring funding in, get grant money, and also give folks the time to attend, these trainings to improve the quality of support that we provide the kids. So I can say in the Austin School District, for example, they've put in a lot of work in developing and increasing grant funding to have this kind of training for everyone in the school district. I've also worked with districts that haven't done that.
Yes, yes. And it's so important because they should consider everyone that's front facing with families and not just teachers or social workers, because there's only one, if we're lucky, social worker in the school system with so many kids and so many families. And that's only if the school is lucky to have a social worker. So I want to just say thank you again for this amazing presentation. I want to take a few minutes to just congratulate you for this being an incredible presenter. Everyone, we will definitely be hearing more from Liz. She will be joining us for future presentations. Thank you so much for this training. Love the wisdom. Could listen to you speak all day. It's true, Liz, such incredible wisdom. You're so amazing. We definitely would love to hear more from you with all other trainings coming through Siembra today. So without further ado, I just want to share with all of you, we're going to add the link again to the survey in the chat. Please complete your survey so you can get your CE. Give us about a week in order to get them back to you, but those surveys need to be completed. Kindly complete the survey. We want to learn more about what are the things that you're looking for. Siembra today is becoming a really incredible nonprofit organization that's not only supporting our communities that are Latine, people of the global majority, people of the diaspora, Latinos, Afro-Latinos, all families and kids, but we are also here to support our social workers that are serving our communities with one, culturally humble trainings in order to better serve our communities, and two, with holding space for ourselves in order for us to feel good enough to continue to be in spaces where we're front facing with our communities. Thank you for all the messages in the chat. Liz will read them. I will also share with you that we do have some incredible upcoming events that we would like to offer all of you. We're going to add them to the chat so you can register, but only register if you're definitely attending, because we do have limited space and it's free. And these are holistic practices that we are bringing into our communities by these incredible holistic Latina practitioners that are bringing in ancestral wisdom of breathwork, yoga, chakra healing, and we will also be having cacao ceremonies in the near future. So we would love to invite all of you to join us, sit together in community, and take care of ourselves, because that's what Siembra today is about. It's not just about planting the seeds of hope for our community, but it's about planting the seeds of hope for ourselves. When you think of Siembra, think of how difficult it was for us to even get here as social workers, having to go to school, navigate systems, navigate financial barriers, maybe our own traumas that prevented us from even focusing and passing exams and entering into specific spaces of academia that we never seen ourselves, right? So think of us as those little people that were going through those traumas and navigating these systems. And now look at us now, sharing and supporting in our communities and being the leaders and being those compassionate social workers that our communities need the most. So because of that, we want to bring beautiful circles to all of you. We want to provide free CEs to all of you. We want to honor all of you for the amazing work that you're doing within our community. In addition, we will also have resources. We are going to upload this video so everyone can have to watch on our new YouTube channel. So kindly follow us on all social media. Follow us at Siembra Today on Instagram and follow our YouTube channel. which you can just Google and just become a subscriber. You will see all these amazing presentations that we're doing so they can live in our YouTube channel. And if you have any thoughts or questions, please, right now is the best thing to do is just ask us these questions. No, the events are not only for Latinx folk, it is for everyone. So we are in the business of building community, and that means all of you are our community now. So please join us, absolutely. And thank you so much, Liz, for all the support. I'd love to hear if, just a little bit more about any last thoughts of how we can serve our families. We do have like about 10 minutes, and I want everyone to get their full 1.5 CEs today.
Absolutely. I added a link to the chat uh, of a resource sheet that I created specifically for the Westchester Austin community, but I wanted to share it as an example. A lot of the links apply statewide or countrywide, but something for you to keep in mind if your school or your district doesn't already have something like that, to see about advocating to develop something like that, maybe have interns develop it, or if something's already been created, have that organization come in and present about it. I put that one together, and I was surprised that even with the folks that were very much in the know, there was new things that I was able to find specifically that had just come up in the last year that were new resources for providers. So things like that can be really helpful. Sharing is caring. So anything that I have that was useful, please don't hesitate to contact me. I'd be more than willing to share, whether it's a list of questions, how do you start the conversations about translating documents if that's something that is impacting your school, your district, um, different ways to address those kind of challenges, having banana split groups, in Spanish, things like that. So
That
please.
is That is such a great topic, Liz, in regards to when kids are the only English speaking person in the family, and then they have to translate for themselves in schools. Is there something that we can do that if we don't speak Spanish that we can do to cause less harm to the children that are translating? I know I was a translator. I hate translating till this day because of it. Like I will not do it.
I can identify with that. Yeah. And finding out, does your school district know, or are they aware that there's actually funding that they can apply for? If there isn't a school translator or district translator, they might be able to qualify for funding to actually have a full-time district translator, especially for a language that is of high need, high demand, like Spanish, right? I know at least in the Austin School District, they have that. They were able to get funding to have on staff full-time translator for the district because that need was so strong, so things like that can be also helpful to know.
Wonderful. And also navigating those systems and just educating our colleagues in the school without being seen as disruptive, right? Just there's a lot of times that we're advocates, but they may not be there yet. How can we work with our colleagues that may not really kind of be able to lean in with that compassion or culturally humble lens?
Yeah, yeah, I often think of the catchphrase, the cliche of social workers, right? Meeting them where they're at. So, I think of like kindergarten teachers that I've worked with, like all they care about is like, following, you know, addressing the behavior, right? And so, okay, if a teacher is interested in this kid because of the behavior, connecting everything I want them to do differently with that specific need that they're saying. Okay, you want them to engage. Okay, let's try to get the mom in. I will be there. I will help. Oh, they never come. Okay, let me make the call. I'm going to do it in Spanish, right? Um, prepping, um, showing folks what they need is actually tied into it, and they should consider investing in what you're offering, because that'll help with what they're actually only interested in. Eventually, they might be interested in more, still only in just that one behavior. Okay, he's finally quiet. He's not biting his pencil. I guess it was a good thing we met with mom. Even if you just get that, that's a win.
It's so true. And I want to also name this and I'm not sure if this was named. I took a very quick bathroom break, that many times children are often unable to pay attention due to unprocessed trauma. And they can also be diagnosed with ADHD and all these other mental health conditions, misdiagnosed because when you have such unprocessed trauma, you're less likely to be able to sit still, to pay attention, to, our bodies respond to what's happening right here. So that's also important to name. And I know this because that was me. I'm telling you, this is everything that we're talking about. It's like, oh, that happened to me. That was my inner child that you were sharing about, and just knowing that all these things were happening in the school and my parents had to come and hear about these bad behaviors and this little person that talks so much and couldn't sit still. Little did you know it was due to just really not being able to navigate those feelings and having support with culturally humble providers because there weren't even enough social workers that spoke Spanish then. So really, to keep in mind about that too. Do you have any thoughts on that?
Yeah, I mean, why this is so dear to me is because it is my experience, right? So, I think, you know, honoring what a child needs. Oftentimes, right? We see a behavior. It's the best attempt at a person or a child in the situation, um, their best attempt at communicating that they need something. So, um, keeping that in mind when we're seeing, kiddos that are frustrated, when we're seeing teachers that are frustrated with these kiddos that are, not listening, not sitting still, not able to communicate. Um, so absolutely. There was something else that I had in mind, but I completely lost my thought. If I remember, I'll put it in the
No,
chat.
no
This is
problem.
this is a great. It's a topic that's dear to my heart because I was that undocumented child, as well. I don't know if you're undocumented or not, but so to be able to give back to that little girl in a way, to be their advocate, support, and to understand what these things may look like. It's very healing.
Absolutely. This is very healing. I want to say thank you again to Liz for being here today. Thank you to all of you who took time to learn and grow. I do want to share with you there is a way you can stay connected to all of us as a community. You can text number 347 202 1374. Once you text that number, you're going to see my name pop up and you're going to just hit send. Then you are going to send me your full name and your email in the next message. That way you're opted in for these text messages between my team and all of you. This is going to give you access to all of our free events that are being sponsored up till December 31st. And we will continue to build community together. I really appreciate you staying connected. We will also add our social media handles again, so you can please give Siembra Today Instagram some love and follow. If each of you follow, we will have gained 30 more followers today. And we are going to be launching a mental health and wellness social media campaign that is going to be in English and in Spanish. And we would love for all of you to reshare so we can get to as many people as possible in sharing information about just recognizing and undoing the stigmas for our beautiful community. So without further ado, thank you again. Follow us on Instagram. Get connected to us through this text. Again, I will put the number 347 202 1374. You have to hit send and when you see my name, and then you have to just send me your full name and your email, and you will be added to our beautiful text chat list. We're doing this to reduce emails, guys. So you're not going to get a lot of messages from us, but when you get a message, it's probably a really cool thing. So you don't want to miss out, and you can register there. Okay. Thank you again, Liz. You were amazing. More from Liz. I think we have some great ideas for next conversations with next workshops and webinars to support our beautiful children and families that are in New York, upstate, downstate, New York City, and everywhere else. Thank you again for being here all. Thank you again to Hispanic Federation, the Uplift Grant, for supporting this wonderful webinar series. Thank you all. Have a beautiful day.
Thank you, everybody.